Good afternoon, staff of Coomera Springs. I wanted to bring forward you today an ongoing issue that we've noticed happening amongst the students of our school, the issue being obesity. It is suggested that currently only 1 in 10 young people under the age of 12 undertake the recommended 60 minutes of physical activity per day. This is evidently a contributing factor to the 9,800 children that are obese on the Gold Coast this year alone. On top of that, we have an extra 19,800 children who are overweight. This extends to a shocking total of 29,300 children who are under the age of 16 that are labelled as unhealthy on the Gold Coast. Having been here for 10 years, there has been a substantial decline in students' dietary decisions. It has also become apparent that less students are undertaking physical activity as a means of travelling to school, and that more time is being spent exhibiting sedentary behaviour. As the statistics show, obesity leads to a variety of both short and long-term health issues. Some of these issues include type 2 diabetes, eating disorders such as bulimia or binge eating, orthopedic disorders and problems with foot structure, liver problems including fatty liver, cardiomyopathy and respiratory disorders. If we can increase our students' physical activity levels, the risks associated with these issues become relatively reduced. In relation to these findings, it is also evident that the lifetime medical costs of someone who is obese from childhood to adulthood is approximately 50% higher than someone who has maintained a healthy weight. Having exceptional healthcare in Australia that subsidises majority of our medical costs evidently costs the Australian government $58 billion in 2008 alone. So why active school travel? Currently in our school there are only minor procedures in place to encourage a healthy lifestyle. Students are given a brain food break, which entails a break for a piece of fruit or vegetables that they are able to consume during class time. Studies show that students who are significantly satisfied and hydrated perform better in the classroom. These include aspects such as increased concentration, and they are less likely to be irritable and disruptive. With no active policies in place, this presents the perfect opportunity to propose a solution to the school's growing obesity issue. A healthy lifestyle should be overtly encouraged, and to do so, we need to establish an active school travel plan by implementing systems such as an active travel passport. Once students receive a certain number of stamps in their passport that they are granted as a reward for active travel, they are able to get a prize or a token for a healthy treat from the tuck shop. Also, addressing the active lifestyle program in the weekly newsletter so that parents are aware of its purpose and rewards. Add into the school's enrolment pack a list of healthy pre-packaged snacks. This can become an easy go-to list for parents when filling their child's lunchbox. And for the students who don't live within riding or walking distance, the answer is simple. Include a suggested safe travel parking locations where students are able to actively travel from. Between 2012 and 2015, active travel to and from school increased by 11.12%. Preference for car travel decreased by 6.9%. Average daily physical activity in students attending active travel schools increased by 72.8 minutes. These findings explicitly show the proven effectiveness that active school travel has had in other schools and the importance of the implementation of this within ours. We are able to build a health promoting school by implementing the following 5 policies as written in the Ottawa Charter. Building a healthy public policy. By sharing our knowledge publicly through our newsletters and school's website, we are helping the public to become better aware on the positive effects of a healthy, active lifestyle. By creating supportive environments through our current procedure of brain food and the implementation of a passport, students feel that teachers are on board with promoting a healthy lifestyle, as we are encouraging it both inside and outside of the classroom. Within the health strand of the Australian curriculum, it is a requirement that by the time students have moved into secondary school, they are able to recognise that health comprises of physical, social, emotional, mental and spiritual dimensions, and that the health status varies across time and contexts. Students will have the knowledge that personal and contextual factors and individual and group actions shape health, well-being, safety and participation in physical activity. They would develop, value and reflect upon their own and others' strengths to promote healthy, active living for all. The School Health Index Self-Assessment and Planning Guide involves members of our school community coming together to discuss what the school is already doing to promote good health and to identify our school's strengths and weaknesses. It then allows for a self-assessment process. It asks to identify recommended actions that our school can take to improve its performance in areas that received low scores. This then allows staff members to implement further suggestions to expand the health promotion further. As evident in the data, Gold Coast obesity levels are continuing to rise. Without implementing any additional programs, many health implications such as diabetes, heart conditions, and an overall poorer quality of life will continue to take shape within our community. These health concerns will evidently affect students, staff, parents, and community members in some way, thus providing poor eating and exercise habits and overall negative impacts on students' views of health. By the implementation of the Active School Travel Plan will ultimately help to alleviate these issues and create a brighter future for all.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time.